So I just would like now to come back to and move on to our next panel. But the aim was really to try and come back to what exists already and explore how we can leverage on current initiatives. With apologies, we have taken some degree of liberty with the program as it stands on your screen. And I would like to invite as a first contributor to this second half of our meeting, Marianne Takki from DG SANTE, in order to give us an insight on the state of play with the NCD initiative and the Healthier Together program. So Marianne, over to you.
Yes, good afternoon, everyone. In fact, it was supposed to be Tim from RCD. He wanted to speak before.
That's fine. I can call on Tim first if you like. But
I think we agreed on that.
The way around.
If Tim is available, I think he is.
Okay, perfect. No worries, no worries. We are amongst ourselves, so you know we can have that degree of flexibility. So happy to introduce you, Tim Raemaekers from DG Research and Innovation. Over to you, Tim.
Hello, everybody. Thanks for the invitation. So I'm standing in for Catherine, who needed to go to an urgent meeting. So I'm policy officer in the Combating Diseases Unit at DG Research and Innovation. And let me just dive in. Oh yeah, wait, I have the controls here, sorry. Okay. So we've already had, from previous speakers, we've heard about the challenges and the urgent needs in the field. So I'll be very brief with our perspective. So because brain disorders are complex, multifactorial disorders, yeah, we need to clearly foster collaboration between multiple stakeholders. Researchers, clinicians, patients, industries, payers, regulators need to work closely together to address the challenges. And there's certainly room for improvement in collaboration. Another issue is access to research infrastructures and resources and the sustainability of resources. And this needs to be improved too. So resources are not abundant, and we clearly need to capitalize on what already exists. So we need to also further structure the brain research area and ensure that all stakeholders work together in an efficient manner. And if we want to conduct impact-driven research in order to develop solutions that are needed, we need to involve those who are concerned the most, the patients and the caregivers. And we need to involve them in the full process of research, from concept generation to implementation and uptake of results. And just on the last point, Europe is very good at producing excellent research, but not so good in transforming the results into technologies and products. So there's clearly room for improvement there. So as was already said, as brain disorders are a leading cause of disability in Europe and worldwide, and because they pose such a great burden to patients, families, caregivers, and the healthcare system, brain research has actually been a long-standing priority for the EU. And despite the advances made, there are still many unmet medical needs, where also best performing drugs show modest efficacy and non-negligible side effects. So there are many challenges, and there's also the challenge of the rapidly growing impact of the aging population and simply the complexity of the brain. So more well-coordinated research and innovation is needed to deliver improved and personalized solutions for patients and healthcare professionals, as well as better evidence for policymakers. So the current framework program for research and innovation is Horizon Europe, and it started in 2021. And the program aim was to have more impact for patients, citizens, and society. And a novel push was to push for more synergies with other EU programs, like the EU for Health program, and there, for example, the Healthier Together EU Non-Communicable Diseases Initiative, which also has a focus on or a strand on the mental health and neurological disorders. And the next speaker, Marianne Takki from DG SANTE, will go into that a bit. And then we also have the 2023 Commission communication on a comprehensive approach to mental health. So the program was co-created with a number of key partners and stakeholders. There were public consultations, there were consultations with member states, there were consultations with colleagues within the Commission and the different DGs, also with DG SANTE. So Horizon Europe should lead to a more effective uptake of results for better prevention, diagnosis, and treatment strategies for brain disorders. So there are 3 pillars and a horizontal part on widening participation and strengthening the European research area. And pillar 1 is on excellent science. And this responds to the need for more basic research and improved access to research infrastructures. And here, the European Research Council has an important role to play. And this is it's a bottom-up way to fund frontier research. Then we have pillar 2 on global challenges and European industrial competitiveness. And this is aimed at improving collaboration. Then we have and I will go into a bit more detail on that very soon. Then we have pillar 3 on innovative Europe, and this seeks to boost innovation, replicating the success of what was achieved with the European Research Council, but then in the innovation area. And just to say, here the European Innovation Council plays an important role, and it funds mainly bottom-up research, but there are also top-down initiatives. And for example, in 2021, there was this Pathfinder challenge on tools to measure and stimulate activity in brain tissue. Now going into more detail in pillar 2, this addresses as I said, this addresses the need to improve collaboration, and it holds the large collaborative projects. And this is needed because of the, obviously the multifactorial nature of the disorders and the need to have researchers from different disciplines working together. And a number of partnerships have also been funded under pillar 2. And then a key public-private partnership is the Innovative Health Initiative, which is a key focus area also in brain research. And this IHI, the Innovative Health Initiative, goes beyond its predecessor and not only involves the pharma industry, but also the life sciences industry, so medtech, biotech, and digital industries. And the approach of having these sectors work together should accelerate the development of innovative products. Now, with the adoption of the second strategic plan in March this year, we have the launch of the public partnership, the BrainHealth Partnership. Preparations are ongoing, and I'll say a bit more on this later. And Ulrike, in her presentation, will also go into more detail. But I just want to add that when we're talking about the BrainHealth Partnership, it's this holistic approach to both mental health and neurological health. And I should just add that key partners of the new BrainHealth Partnership are also the public partnerships, ERNet Neuron. So this is the network of European funding for neuroscience research, and JPND, which is the EU joint program on neurodegenerative diseases research. There are also other partners too, but I'm not going to that right now. Sorry, wrong button. Okay, here you see a scheme of various EU funded initiatives with the timelines running centrally. And these different initiatives cover coordination and support actions. And we've had the EBRA CSA, which was led by the EBC, the European Brain Council. We have the ongoing CSA in purple on the top, brain health, which we'll talk about in a moment more. We have had a number of ERNet co-fund actions, in top in green, the ones related to JPND, so the JP co-fund 1 and 2, and on the bottom, the Neuron co-funds 1 and 2. And then we also have the Future and Emerging Technology Project, FET project, the Human Brain Project, and its main output also being the eBrains, the digital research infrastructure called eBrains. And so just to say, the CSA is paving the way to this brain health partnership, which is expected to start at the start of 2026. the idea behind the new partnership is to put the existing brain initiatives together under one umbrella. So this includes the JP&D, Neuron, the Human Brain Project, and its output, the eBrain's digital research infrastructure. And the aim is to accelerate the delivery of preventive, diagnostic, therapeutic, and care solutions to foster brain health in citizens and patients. We need to align efforts and funding from member states and associated countries in brain health research under one strategic research and innovation agenda. And this agenda should facilitate working together and achieving synergies so that we can deliver more ambitious results and have a greater impact. We need to capitalize on existing initiatives in Europe and bring them closer together, but at the same time, we should also strengthen links with other key entities like other relevant partnerships, rare diseases, Era for Health, and so on, and then other relevant infrastructures, the BBMRI, Biobank, patient advocacy groups, scientific society, citizens, and so on. And this initiative needs to have clear objectives and ambitious scope and goals. And member states hopefully will support it. And as it's about fostering the European brain research area, and there will, of course, also be EU funding. Now, just a few words on the CSA. As Ulrike's presentation will cover more on it, as well as an important note, which I would like to make at the end of this slide. So the CSA is paving the way to the partnerships. We've had a number of key meetings. There are certain key tasks to be delivered by the CSA, this strategic research and innovation agenda, implementation plan, governance structure. Ulrike will probably say more about the entity she works for, the project management agency of this German research organization. A draft proposal of the partnership has been developed. There's a strategic research and innovation agenda has been developed, and there's been a public consultation. And as I said just previously, we should aim for an ambitious budget and for an ambitious partnership like this one. And the note that I want to add is that, firstly, the partnership should work in tandem with the initiatives I had mentioned earlier, like the Healthier Together initiative and the comprehensive approach to mental health. We have to really focus on exploiting the results. We have to really focus on maximal exploitation of the results and deliver impact. And the partnership, I should say, is very well placed also to deliver on the new political priorities, which our Commission President in July this year laid out in her political guidelines. And this includes also priorities in mental health, in autism, and in degenerative illnesses. And lastly, I just want to mention that if you want to keep informed on our activities, please consult these websites. In March 2024, we had the European Research and Innovation Days with 3 sessions on mental health. There was the Horizon Europe Health Info Day in June 2023, and then another one is expected in May 2025. And recordings of the previous events are available if you'd like to see them. And thank you for your attention.
So thank you very much, Tim. That was again a very thorough overview of the pace of progress on your side within DG Research, as you alluded to the synergies and connections with the initiatives on DG SANTE side. Marianne, I'm happy to give you the floor now.
Yes, good afternoon. Thank you, Tim, for giving the big framework. So first of all, thank you for inviting DG SANTE to speak about the public health actions in the area of health and brain health. We all know that healthy brain and healthy mind are central to good health. And this is why finding long-lasting solutions to protect and promote them is so important. Let me start by describing a little bit what we are doing on mental health. Tim already mentioned the comprehensive approach to mental health. This was the biggest strategic framework that has been developed at the EU level on mental health. We presented it last year, and it is the cornerstone of the strong European Health Union that we are building. So it's strategic, and it's also very political. This comprehensive approach put forward 20 flagship actions, and they cover a lot of different topics and issues. They are, for example, on health promotion, improving mental health promotion, prevention and creating new interventions and solutions, and improving access to treatment and care, and quality of life. We also want to strengthen gathering data and improving health information and knowledge. And finally, making sure that the health professionals across Europe and also other professionals who are working on mental health issues can learn from each other. For that purpose, we have launched a big exchange and training program. We have identified 1.2 billion euros in funding to back up all these actions. You may have seen that we have a tracking framework, which is pretty much a sort of a plan where you can see each of the flagships and how they have been implemented. We published it in May during the European Mental Health Week. The Brain Health Partnership is one of the flagships, and I think there was a question in the chat, and I think it's extremely important to understand that DG SANTE did not do the mental health approach alone. We did it with 20 different commission services. So as such, already it was very comprehensive, and we will continue to work very closely with colleagues. Now, in addition to mental health, if you look at non-communicable diseases more horizontally, of course, DG SANTE has already experienced for more than 20 years for disease prevention and health promotion. Most recently, 2 years ago, we published a strategic framework to support our work on NCDs. It's called Healthier Together, EU NCD initiative, and I was happy to see that some colleagues are also following from the stakeholder side Healthier Together initiative work. It focuses on the sort of the main killers of Europe, or the main burden of disease in Europe, and that includes mental health and neurological disorders. It also addresses cardiovascular diseases, diabetes, chronic respiratory diseases like COPD, asthma, etc. And we have a horizontal strand on health determinants. And one of the key elements of this framework is also to reduce health inequalities across Europe, within countries and within regions, and between population groups. It was co-created with the member states and stakeholders, and for us, therefore, it provides the steer for actions to address these major challenges. Of course, the EU for Health program is the main financial support instrument, and we provide funding for national authorities, that is member states, and for civil society organizations to implement actions under the Healthier Together initiative. Now, focusing on neurological diseases, 4.5 million euros have been allocated from this EU for Health program to member states to collaborate on dementia and stroke. The joint action is called, I don't know how to say this, but it's called JADE. In Finnish, it would be JADE, and it is led by Spain. It will focus on dementia and to foster early detection through 38 different pilot or testing pilots and interventions across the EU. It will start next year, 1st of January. And then not that much money, but still 300,000 euros will support civil society organizations to develop practices that can be innovative for tackling dementia and eliminating stigma. Now, one of the colleagues, I think from the US, mentioned that aging population is a huge issue over there. It is also in the EU, and we will see major trends and impacts when the number of people over 65 will increase drastically in the future. They will need long-term healthcare and treatment, and of course there will be then pressure on healthcare systems, the health workforce and economies and societies as a whole. So as you can see, there are a wide range of challenges. Brain health is of course one of them. We have also cardiovascular diseases. If you look at specific silo thinking type of diseases, and therefore the Commission supports a comprehensive approach that promotes health throughout the lifespan. So it goes from all levels and bringing together different actors, different policy areas, and different players, stakeholders, member states, to create supportive environments to promote healthy lifestyles and to create solutions and interventions on disease prevention from an early age to foster healthy longevity. This approach was discussed with the member states and Norway and Iceland at our last meeting of the Public Health Expert Group, which took place here in Luxembourg this year. There are two major joint actions I would like to mention because I think they have direct links to brain health. The first one is led by Norway. It's called Joint Action Prevent NCD. It's the biggest joint action we have in the area of NCDs with the EU funding of 76 million euros. And it aims to address the root causes of heart disease and other NCDs. So it has, of course, also benefits for brain health. And another one is on cardiovascular diseases and diabetes. It's called Giacardi, and it's led by Italy, Professor Onder. It has a budget of 53 million euros from EU, and it supports 21 member states to work together. And they have an impressive number of 142 pilot projects across Europe. And I really invite those working on health determinants related to brain health to look at these too as well. And then we have provided 7 million euros for different stakeholder-led projects on health determinants, again linked to brain health. And now finally, besides the work we do with the member states under the Healthy Together, the Public Health Expert Group, with stakeholders through this health policy platform and so on, we also are addressing major risk factors such as tobacco, alcohol and diets through legislation and policies. Tobacco control policy and legislation is of course extremely important at the EU level. So maybe I stop here and I would be happy to answer any questions. I look forward to receiving the joint statement from the thematic network and to see how it fits into the future priorities of the next Commission on Public Health. Thank you.
Thank you very much, Marianne, not only for your contribution, but for this openness towards future interactions in building up the joint statement. We'll certainly be back with when the draft is taking shape indeed. Thank you very much for that. I'm afraid we need to advance into the agenda. I don't think there were any particular questions aimed at our speakers, but if you do, please log them in the chat, as everybody is quite eager to know more about our development. And of course, Joe, the summary of the event will be made available and you'll be further informed as we go. I'd like to invite to our virtual floor Ulrike Bußhoff. Ulrike is the coordinator of the coordination and support action leading up to the Brain Health Partnership that was mentioned by Tim. And Ulrike, I'd like to really thank you for participating to our event this afternoon. But also we are eager to understand what the Brain Health Partnership actually is going to deliver and how this can be let's say, a foundation in order to expand further action at EU level. So Ulrike, the floor is yours.
Thank you very much, Fred, and thank you for inviting me. And just to clarify the title, so yes, I'm the coordinator of the CSA BrainHealth, but I'm also with the DLR Project Management Agency, and we are running the health research program for the German government. And that's why they are asking us to support them and engage with European projects. And that's why we are coordinating this CSA, but also the network mentioned earlier by Tim, which is called Neuron. So next slide. We have heard a lot about challenges. The burden of disease is enormous. Medical need is very high. And there's a research gap. We have a knowledge gap there. There is also an implementation gap and an access part there. But what we're talking about now, and that's what also Tim was mentioning before, is a question about generating knowledge. And so we are now focusing in the next few minutes on the research and the development part. And you have seen, in spite of considerable efforts and investments in research and innovation in the last decades, effective prevention strategies and therapeutic options for mental and neurological disorders that are accessible for everyone are still lacking. So next slide. So you have seen this landscape slide also from Tim, and the important message here is there is a rather complex picture of different initiatives, and we have heard that on earlier comments from fans and also in the chat that they were asking us that the agencies, the funding agencies, the national ones and the national ministries of the member states should talk to each other and coordinate and align. And that's basically what you see here already. There has been an enormous amount of coordination and alignment in the past 20 years, also supported by the European Commission and their funding, where we all joined together and funded research. And we have been throwing around some numbers, and I can add some there too. So just these two networks which have been mentioned before, which is JPND and Neuron, they have published 39 calls and invested, and that means a public investment over 400 million euros. So this is already a huge effort. And what you see there is it's not only these two networks, there are others. There is an infrastructure part, which from the Human Brain Project and now from eBrains, there's a strategic part there. And this is all being channeled now into one joint action, which is Commission and member states promoted. So that means that we are doing exactly what has been asked before, that the funding agencies and national ministries from the member states are talking to each other, agreeing on joint actions, agreeing on joint programs and conditions, how to apply for them, how to evaluate, how to finance. So this is a huge endeavor, and we are already on a good way there. So this is what we are presenting here in the next few minutes. Next slide, please. So Tim already mentioned that there is a project which is called CSA BrainHealth. So we are basically the preparatory phase for the European Partnership for Brain Health. And the most important part, what we're doing in these months, we started last year, and we are having this year and next year to prepare further, is the most important part is to develop a joint research and innovation agenda, because this is the tricky part, no? To get everyone and all the funders which are there together with patient representatives, with the research, to get them all together with a private sector and to come up with a relevant research and innovation agenda, and to come up with a governance structure which is really working, because the scope is enormous. We had these comments already in the chat, but also from Tim and others, that what we are looking at is the scope which is across the entire area of brain health. So we are doing exactly what has been asked also in the chat, that we're not talking about single indications or a group of indications, but we are talking about brain health within a holistic approach. So that means we are basically asking for a very broad scope here. And to keep that efficient, we need a good governance structure. And that's what we are developing at the moment, and also the work program around that. So that means dialogue. And that's why we're partnering also with EBC in this endeavor, dialogue with the stakeholders, patients, citizens, society, private sector, and global partners. And the overall idea is to create a brain health ecosystem to enable broad discussions in the preparation for this partnership. Next slide, please. So this is what we are looking for. The cornerstone of the current project is the development of this agenda for research and innovation. And just to some food for thought, what we're looking here is a lot more than happy workers, to be a little bit provocative, because the perspective of families living with dementia is completely different from the perspective of a maybe not so happy worker. So obviously there is prevention in there, but it's prevention for brain disorders and it's promoting brain health. Yeah, so because we are looking at a situation where we have limited budgets and we need to convince the ministries and the member states here to invest into these kind of endeavors. And so what they are looking for is impact, as Tim also mentioned. So the priority one is the ability to comprehend, prevent, and treat disorders affecting the brain and sensory organs. And that really fundamentally relies on the understanding of the mechanisms. Yeah, so there is what also has been mentioned by friends, to create a knowledge base there. And the challenge is here to build on improved understanding of the brain development and its functioning. Priority 2 is understanding the pathophysiology and identifying the mechanisms underlying the brain disorders, so that we are really able, and that is basically what I mentioned before with the knowledge gap there, that we're really able to develop diagnostics which are precise, which characterize appropriate time windows for interventions, and to select or combine appropriate and effective therapeutic interventions. Priority 3 mentioned in the agenda is improving care and support for people living with brain conditions and their caregivers. And that requires a comprehensive approach that encompasses research translation into clinical practice. And that is one of the hurdles I would be mentioning as the important part when you ask me what is the take-home message there. So the aim is to bridge the gap and accelerate the translation between research and practice, especially clinical practice. And for that, we need to involve patients in the research process and to get really tailored interventions in care which are tailored to their needs. Yeah. Priority 4 is the aim to promote research in social sciences and humanities research to better understand the impact of what we are doing there. So the societal, the socioeconomic, as has been discussed before, but also the cultural, legal, and ethical determinants of brain health across the entire lifespan. And that means individual, psychological, social, and environmental factors included there. And that is not only looking at the disorder part, but also which of these are promoting resilience and brain health. And when we are looking at these kind of priorities, what we have also developed is a portfolio of transversal priorities, which are instrumental for the implementation and reaching these kind of objectives. So this is translation of research results into market. So there is innovation part, but also data harmonization and access, patient and public involvement, and again, the ELSA aspect of brain health research. So this is absolutely vital to bring research results into praxis and for that generate tangible impact for societies in Europe and beyond. Next slide, please. So what we did, we developed this kind of scientific research and innovation agenda with the experts and our stakeholders. And then we started a public consultation, and we're really happy, even though it was summertime, that we received many, many responses. Also from different sectors, which is very important for our further analysis of the results. And as you can see, this was also from the geographical spread. This was really fine. So we are happy to have now an agenda which is validated also by our stakeholders. And we are now starting the discussions with the ministries and the funding agencies, which of these priorities can be implemented with which kind of instruments. So that is basically the work what we're doing in the next month, coming up with a proposal for a work program and starting the governance discussions with the ministries, and then hopefully start 26 with the partnership. Thank you. So next slide, the very last one. If you need more information, there you can have the web page and contact us with the team.
That's where to find you.
Yeah, where to find us, exactly.
Super. No, thanks a million, Ulrike, and thanks for this explanation on how the partnership is going to be holistic, but also impactful. and across the board. So, and I like the way by which this is responding to what we were saying in opening this workshop, in the knowledge generation, but also in the way by which we can improve outcomes for people living with a brain condition. So we can certainly come back to this in the course of our discussion. But before opening it up, we wanted to give also the floor to less institutional initiatives, but more stakeholder-based or stakeholder-driven partners. So I know that Professor Bassetti has an issue with timing, so I would probably invite Professor Mika Martikainen first, who is the president of the Finnish Brain Council. And Mika kindly agreed to join us in order to provide an insight on the progress made in Finland and the ways by which the brain agenda is on the move. So Mika, over to you.
Thanks a lot, Frederick, and very happy to be here. Thanks for the organizers for inviting me and giving the chance to tell you something about what we've been doing in Finland and some also thoughts about how to proceed. So my name is Mika Martikainen. I'm working as professor of neurology at the University of Oulu in the north of Finland. I'm currently the chair of the Finnish Brain Council. I'm also the vice president of the Finnish Neurological Association, which is the professional organization of neurologists in Finland. Obviously, this is a bit of a repetition regarding things that we've been hearing from many presentations this afternoon. We are also approaching in Finland this the whole in a way of neurological and psychiatric or mental health issues and taking the perspective of brain health as a whole and brain health of individuals in a society, which I think is obviously a very important perspective. And there you see some of the frameworks and some of the plans that have been published already for the purpose of developing our ways to enhance and foster brain health and healthy society. So the mental health action plan of the WHO, the IGAP by the WHO, and the optimizing brain health program. And I think we're also in Finland, we're very heavily relying on the framework laid by EAN for the brain health strategy, which is I think a fairly nicely presented comprehensive program on how to approach brain health of individuals in the society. Moving a bit forward, so in Finland, there are actually partly because this is obviously a very common theme and there are important stakeholders that have been approaching these issues for several years. It's actually we have several important people and organizations that we try to align and get intimately working together to develop a common approach to brain health in Finland. So let me carry you through this in the following. So the national brain health program that was launched in 2021 was actually launched by Aivoliitto, the Finnish Brain Association, which was formerly the patient organization for stroke and aphasia patients that now is under a different name. And the program that has been developed here is very much oriented towards a sort of positive understanding of it has an emphasis on protective factors, ways to enhance brain health of working age people, of children, adolescents, things like sleep quality, and I think very important things, and obviously as we heard from presentations before, things like healthy economy or economy that's positive and good for brain health, and on the opposite side, possibly things in society and an economy that might be detrimental to brain health. I think these are very important issues which have been brought up by this program. But I think there are also some other things which are very important and that have been possibly lacking a bit in this approach. And then this is why we at the Finnish Brain Council are trying to develop. And actually, the Brain Association is a member of the Finnish Brain Council, so they also on board in the Finnish Brain Council, which is a joint organization by scientific associations, patient organizations, and also other stakeholders and that are interested in promoting brain health in society. So we're trying maybe to move forward to the EAN style of a more wholesome, comprehensive approach, where the positive health is one thing, but there are also other very important things to remember and take on board. NeuroCentre Finland is a collaboration of neuroscience experts, universities with medical faculties. The Wellbeing Services Counties is the framework of the public healthcare system provision in Finland, in the current framework, and essentially this is about university hospitals that provide the tertiary level healthcare and also medical research, medical education that are involved in the NeuroCentre Finland, and all these parties are involved in developing strategies and ways to promote brain health for us. So in this framework, we as said, we are trying to develop a comprehensive program in line with the outlined EAN strategy. As in previous presentations, I would very strongly agree that research on both healthy brain function, physiology of brain function, and also on brain disorders, the pathology, pathophysiology, development of brain disorders is of foundational importance. Without very strongly research-based and science-based approach, I think it's very difficult to reach the goals we are trying to reach. I think this also applies to all positive health approaches and brain economy approaches. I think it's very important that we strive to gain research basis and evidence base for all these approaches, so that we know that we can deliver what we speak for. Prevention, diagnostics, treatment, and also rehabilitation of brain disorders is very important. So we know that despite all the efforts we can put on prevention, unfortunately there will still be people who will suffer from various mental health or brain conditions, and I think this is something we have to keep in the focus very much to try to work very hard on developing ways to help people with and families with these issues as much as possible, and as we know today, to develop better ways to deliver treatment and early diagnostics. Also, not to forget the positive brain health approach and window, sort of speaking to brain health, well-being in society, creating better working life, creating economic framework to support healthy brain in society, this is obviously very important as well. On societal and political level, I think it's important, and what we're trying to do, and the EU campaign now with the EBC was one of the very good example of steps taken to this way, to promote changes and efforts in social policy, education, legislation, economy, to foster better brain health for everyone. So we are very late in the session, and I try to keep this fairly compact. So this is basically all I had prepared for this afternoon. I'm very happy to take questions, and I thank again for the possibility to speak here today. Thank you.
Thank you very much, Mika. That was a very nice example, and thanks for making it. Actually, I'd like to stay with you, and maybe if in a matter of less than a minute, can you give us an idea as to what benefit you would see in developing such an EU coordination plan, as we are calling it?
Well, I think one of the important things is that for the first, I think research, if efficacious and very high level, top level research in brain disorders and brain function, that has to be international. It cannot be today. It's not possible to do it in every country by themselves. It has to be very international. There is need for EU level funding for very top level work, and I think that's one of the things why this is important. Another very important thing is that with, I think in Finland the government is struggling with the economy and struggling with the money. I think this is the same problem for unfortunately for most of us in EU, and I think it's easier to put pressure on governments when there is an EU level consensus and top more from the kind of the joint EU level agenda and agreement on the importance of brain health. Because if we all have to work separately in our own countries, there is less a pressure for the politicians, and there is more risk that we don't have the pressure and the voice to speak for these issues as we would like to have. Maybe a third thing is that also I think I'm also active in the ERN framework for the rare disorders treatment and development of care in Europe. I think it's very important also for the patients to in a way that we develop ways of international care and gaining the expertise and knowledge from the best experts all around in Europe, and also for this level, I think EU level collaboration is extremely important.
Awesome. Thank you very much, Mika. And actually, you're giving me a few discussion points, maybe Ulrike, that I can share with you about this international dimension and the value. How do you see? Obviously, you've explained how you saw the partnership to take shape, but do you see a potential of it to be really anchored into this vision of a broader coordination plan and broader initiative as we have been discussing so far?
Yes, definitely. As I said before, there is a very, very broad scope of the brain health partnership, so there is a way to anchor that. But it's also, I was mentioning that to manage expectations, because it has to be really clear, and I'm here completely with Mika, that this partnership is running with EU finance and member states budgets. So we need to convince the member states to invest here, and that's exactly what we're doing at the moment. It's basically a roadshow we are running here to convince the ministries and funding agencies to invest. And for that, it's critically important that we can demonstrate impact. And that's why I was saying earlier, no, we have to show that we're really tackling the medical need we are seeing here. And I'm also with Mika for the funding part. What we are looking for is to secure long-term funding. And this is the first time that we are looking for a funding stream, which is with a perspective of almost 10 years there. So this is unique. And it's also unique in this funding landscape that we are looking for a partnership which is just dedicated to one organ. So if you look for the other instruments which have been mentioned by the Commission, these are a lot broader. There is pandemic preparedness, rare diseases, personalized medicine. This is a huge scope. And here we have the possibility to make a difference. And what we're looking for is to create a basis for the researchers to focus on what is creating impact. And that's why I was mentioning this research innovation agenda, because it's really generated based on the feedback of the experts here in the field. And what is our goal here is, and that is maybe the second take-home message here, is what we need to have there is to support collaboration in such a way that the researchers and experts and clinicians are sharing data and that they are harmonizing the data in such a way that we are able to analyze across the sectors. So we're not only having research data, but also implementation, real-world data, and really understand what's happening out there, and thereby generating impact. So that will be my both take-homes. There is secure long-term funding and support collaboration by sharing and harmonizing data.
Awesome. Thank you very much, Ulrike. And obviously, Tim or Marianne, I mean, I'd like to invite you if you have any more comments, because we are now entering into the space of, is it convincing for civil servants? Is it convincing for policymakers? Is it convincing for governments? I know we could talk ages about that, but in a minute or so, if you have a sense of, are we going in the right direction with this endeavor? And I don't know who would like to start. Marianne, are you okay? Can I invite you?
I can say a few words. So thank you very much for all the presentations. I'm very happy to see Mika from Oulu as well. It's always good to see a co-patriot when I'm alone here with all this commission, you autocrats. Now, in terms of I don't have advice for lobbying. We're being lobbied. I can only tell you that a lot of people are lobbying us. So that's why I tried to say in my intervention that comprehensive approach on prevention is something that sells right now. It's because I have every week meetings with now BrainHealth. There's also liver health, the Friends of the Liver. There's so many organizations and organs and diseases. And I think that what I try to say to everyone, also for respiratory people who are lobbying for those patients, is to join forces. I think this is the only way anyone can survive in today's world on any topic. You need to network, and I don't know how these thematic statements are done, but it's something, of course, very important because you were selected out of many. So I think you have a very good opportunity to explain why is it important, how it's important, and what can it do. So keeping it very focused and practical. There were a lot of great ideas, and I love to hear from the US colleagues what they are doing there. But keeping in mind the pressures we have in Europe, member states, Finland, economies. I mean, the reality is reality. So it's really what the political parties of the member states are, what they will be by the Commission, what they will be by different, universities and so on. It's a very complex picture, but I think brain health is there to stay. Keeping in mind, of course, that mental health people and mental health lobby organizations and patient organizations think that it should not be sort of mixed with the neurological disorders. So I think there's a way to go, but the key is to network and to have a common message from the stakeholder world, because there's so many needs and so many challenges, and we really need to tackle those where we can have most impactful actions. But I think that's where a team comes into picture, because they have lots of money in research.
Thank you very much, Marianne.
Well, I mean, I can just only echo what Marianne said. Basically, the need to sufficiently collaborate and integrate not only this public brain health side, the research side, and all the other actors, and then come up with this agreement on this joint priorities, and that's really good for communication and awareness raising. And And this way you can realize the goals. They're so ambitious. And yeah, just to come back onto the research side, it's really, really important to exploit the results, you know, identify the practices, the promising practices, and get it into the clinical practice or in other areas. So I mean, I just wanted to emphasize that point.
Thank you, Tim. And indeed, that resonates very strongly with the various elements of the conversations that we have had today. We are slightly beyond our end time for this webinar, so it's probably time for us to bring it to a close. But I can only do that by thanking you all for contributing today, for your time, but also for these thorough presentations and sharing of perspectives. It was very helpful in us collecting this input in order to go ahead with drafting a first proposal for the joint statement. We have had really a handful of these perspectives coming from the patient community, the scientists, but also experts providing us with this kind of a broader vision. And with our concluding panel, I think that we are already making progress in connecting those different dots, and more is going to come. So as I said in the introduction, the consultation is now open for any inputs you would like to provide within the audience. So please be in touch, use the platform in order to do so, as this is the structured way of dialogue in us going ahead. And we can definitely invite you to pencil the 24th of October within your diaries for next occasion to have this type of interaction.